So Dan, before you began your research, what was your attitude towards this subject? How did it change, and how was your thesis statement involved?
Okay, so my attitude towards the subject, or first of all, my subject was the rights to birth control. And before I began this project, I honestly didn't know much about it. I just had heard things from people, but I didn't honestly know what the different perspectives and all the different sides of it were, and what their beliefs were, and like the reasons for their beliefs. So I didn't know a ton. From what I had heard, though, I felt like it should be a right because I had heard that it does have an impact. I just didn't know what the actual facts were or anything like that. After doing my project, and now I'm more grounded. I do think more people should have access to it because I have seen that it does have an effect. And one interesting point that I was brought to and kind of changed and became my thesis statement for my project was that it's thought too much of as like a women's issue and not as a public health issue, and it needs to be thought of more in public health issue sort of mindset because it is a public health issue, and that was what kind of drove my thesis statement in my paper.
So off of the same question, for me, my topic was about how we should have a more socialist healthcare system, and I used diabetes as an example for a lot of the policies changes that could be made. I have always been a supporter of a universal healthcare system because just from what I knew about it, it is like the thing that the type of policy that's really going to actually help people, and it's a policy that doesn't care about the bottom line, it just cares about the people. Through doing my research, though, I found out actually a lot of faults about the system that I didn't really know about, such as like the amount of time that doctors spend with each patient goes down dramatically because they get paid more on like the patient, like per patient ratio versus like the type of care that they're doing. And like I'm a human physiology major, so like I know a lot about how like patient care, like the longer you spend with the patient, the more likely you are to be accurate about your diagnosis and the better care that they get. So that kind of made me question my belief in it because in the long run it could do a lot of harm, and like people wouldn't get diagnosed as quickly or even diagnosed at all, and that could be extremely detrimental to their health. I also learned though that with the deterrence there were other positives that I didn't realize. There are so many people in the country who can't afford healthcare, and like a lot of people will stay on their parents' health insurance plans as long as they can, but they can only do that until they're 26. So like having a universal healthcare plan in place so they don't have to worry about if they're going to pay their mortgage or they're going to pay for their health, such as like for diabetes, a lot of people choose to like buy groceries or pay their mortgage versus paying for their insulin. So with universal healthcare, they wouldn't have to make that choice. And that, like for me, I just always believe that like people should be first, and it shouldn't be about the money; it should be about the people. So that kind of shaped my thesis statement in going from just like universal healthcare is like the perfect thing, and there are lots of things wrong with it, but it's still going to save people in the end.
So Dan, which of these sources that you used was most helpful, and where did you find it?
Okay, the source that I thought was most helpful, it was a source that explained, or it didn't explain, it kind of illustrated how teen birth rates have dropped dramatically in the last like 20 years. And it also talked about how much money we spend on teen childbearing. And that was a really good point to show, that source was really good to show how birth control and access to birth control does have an actual impact, and a positive impact, beneficial impact on our society, because it not only affects people who are involved with like, even with teen childbearing, people who are teenagers who are getting pregnant and having kids, but also all of us in the society, because it explained how teenagers, when they have children, they usually are not as wealthy because they're only teenagers, they don't have good jobs or anything, so they rely on lots of public assistance, and so then we end up paying to help out, and lots of taxes and things go into helping them out, with all of that public assistance to help out with them for paying for their kids and everything that comes with having a child and everything like that. So it showed that it doesn't only affect people who are getting pregnant, but also everybody. And it told us that it gave the numbers of how teen birth rates have dropped, and it does show that the access to birth control has an effect, which is good too, because it explained how when teenagers get pregnant and have children, they usually have lower paying jobs as they get older because they don't have the opportunity to go and get a better education because they're caring for the children. So then it just kind of is a big like feedback loop where they don't get as good of an education, and their kids end up not getting as good of an education because they can't make as much money to pay for a good education for the kids, and it's just like this cycle. And people who usually are poor have a higher likelihood of having teen childbirth, and so it's like really access to birth control can help get everybody out of this loop.
So the source I found most helpful was called Insulin's High Costs Lead to Lethal Rationing, and it was a source from the National Public Radio. So for me, the source explained diabetes and the history of diabetes and the history of insulin and what it came from and what it's become, as well as it put out an emotional story about a man who was kicked off his mother's health insurance plan when he turned 26, and a month later was dead from lack of insulin in his system because he had been rationing his insulin because it cost over $3,000 a month for him to get his insulin when he only made $26,000 a year. So he couldn't afford his life-saving medication. So that really showed like where our healthcare system is at right now for me. And then they also talked about like the parts of universal healthcare systems that would fix this issue. The article just really shaped my paper and like how I wanted to present the topic, and like the fact that I wanted to focus on insulin because it is such a life-saving medication that has gone up nearly 300% in the last 12 years. So I just thought it was like a really important subject to shed light on, and this article really helped me do that.
So Dan, what new terms or vocabularies did you encounter during your research?
A new term I encountered was teen childbearing. The concept itself is pretty self-explanatory, but what's interesting about it is that it doesn't involve people who are just under 18 and pregnant, but also people who are under 18 and pregnant and have children. So you can have children and be accounted for in the teen childbearing category, or be pregnant and be teen childbearing.
For me, a new term I learned was diabetic ketoacidosis, which I kind of knew from my background in human physiology, but I didn't know exactly like what it was. And it turns out that it's because blood sugar becomes so high without insulin, your blood actually turns to acid because of the increase in H plus ions that come from the increased glucose in your system, which is what insulin breaks down. So I found that was a pretty important term because that is what's killing diabetic patients who can't afford insulin.
What can we do as individuals to solve the problem related to this issue?
Okay, I talked about it a little bit earlier when I was talking about my thesis statement, but one thing we can do is change the way we think about access and the rights to birth control, because if we do think of it more as a public health issue, we will realize that it's not as much about what people choose to do with their lives and more that it is a public health issue and it does make a difference. Whether we can't control what people do in their lives, so we just have to work with what we have or what we've got, and like it does make a difference. And if we can reframe it not as, oh, these people shouldn't be doing this, but rather they are, and what can we do to like help out the nation and ourselves too, because it does affect ourselves as well.
In regards to universal healthcare, everyone just needs to do more research. I thought I kneue everything that I needed to know about this, and I was pretty wrong. And then the second thing we can all do is go and vote. Regardless of what you're voting for, the current healthcare plan isn't working, and we need a new one.
How will this experience writing this essay change the way you approach your next research assignment?
Writing this research assignment has made me think about how I need to really understand both sides, and once I've really understood and explored both sides, try to make the decision that impacts people on a larger scale, and not just me individually, but the most people possible.
Next time I write my essay, a research essay, I need to do all of my research way in advance because I did additional research the night before the essay was due, and I found that article I spoke about earlier that completely reframed how I wanted to talk about my essay. So that made me quite crunched for time. So I want to fix that next time.
Thank you.